everybody, it's Dr. John Hayes. You're listening to 95.9 WATD. This is Sunday night, Beating Neuropathy and Chronic Pain. And before we cut to the break, we were talking about facing chronic pain, talking about what a huge burden it is on our society. And the last thing that I ended up with before the break was talking about how the most common cause of chronic pain is not taking care of acute illnesses or acute pain. Basically, that's not always true. Look, the bottom line is that unfortunately people do suffer serious diseases and illnesses, and in some of those cases it's extraordinarily difficult, if not impossible, to prevent some type of permanency, which of course includes pain that tends to stay with people. But for a lot of us, for the most of us that are relatively healthy and mobile, one of the ways that we really get ourselves into trouble is when the brain becomes tricked and the nervous system becomes tricked into thinking that a painful stimulus that has been removed is still present. And this, of course, is one of the things that can result in some of the most challenging cases of chronic pain that we actually see in our clinics. But before we talk about that, what I'd like to do is to talk a little bit more about where we most commonly see chronic pain, and that would be really with any host of injuries, and this can include physical injuries, and it can also, of course, accompany psychological trauma, and we'll talk about that too because it's very, very important. Chronic pain can affect patients of any age, weight, state of health, economic level, so on and so forth. It doesn't have any discriminators at all. This is, unfortunately, what makes chronic pain one of the most commonly diagnosed conditions in medicine. One of the issues we have, of course, as clinicians, one of the things that's most difficult is to make sure that we know with the highest level of certainty what is causing a patient's pain. Now, sometimes, of course, in the clinic and the hospital, this can be very straightforward, and other times, such as in the cases we're talking about tonight where conditions are chronic, it can be much, much more challenging, require extensive diagnostic tests, and unfortunately, with a significant number of patients, we just never identify with 100% accuracy what may be causing the chronic pain. I tell patients all the time in our clinic, and I teach my students the same thing, is to explain to patients that I want to continually know what you don't have. In other words, we are ever vigilant for things that that might be contributing to pain. And probably one of the more common things that we see would be smoldering infection. In one of the previous workshops we spoke about the influence that a chronic infection like a chronic urinary tract or sinus infection can have on inflammation and the perpetuation of pain. Of course, any underlying diseases, heart disease, diseases in the abdomen, and of course the spine itself can cause chronic pain, and sometimes they're not always readily identified. So again, part of being a good clinician is to make sure that we're ever vigilant for things that we can fix, and of course things that we can't. But as a patient, I think one of the most important things that you can do is to put yourself in the hands of a trusted healthcare provider to help you sort this out. Because before the break, we're talking about this issue called cyberchondria, which is where we tend, especially in this day and age, to kind of get latched on to certain concepts or certain ideas that we have picked up online, or worse yet, from a well-meaning family member or friend. And the bottom line is, if you go off on a tangent, try to treat yourself exclusively without knowing what's going on, really can lead to a whole host of problems. So, knowledge is everything. Knowledge is power. I would say that one of the most important things that all of us need to do is to empower ourselves with the understanding, the highest level of understanding possible of what our underlying health issues are, and then, exploring alternatives to treatment that are traditional, non-traditional, and so on, really can be much, much more effective. So with that said, we want to talk a little bit more tonight about chronic pain. We want to talk about the various types of chronic pain. And there really is several different phenomena. Some of this is going to be pretty apparent as we go through, and some will obviously require a little bit more thinking. But the first type of chronic pain is what we call somatic pain. And somatic pain is the type of pain that occurs when the sensory nerves, which are basically the nerve endings, if you will, as we commonly refer to them, the ones that reside in our soft tissue like the muscles, the skin, the ligaments and tendons and so on and so forth. When they get disrupted or they get injured, they send pain messages directly to the brain. A couple of examples of that would be stubbing your toe, for example, which if you do in the middle of the night when you're half asleep can be very, very painful and actually quite debilitating, but usually temporary. It's not the type of thing that turns into a permanent injury. Some of the things, some of the somatic types of pain that can turn more chronic, of course, would be burns. Burns, as you know, at some stages can be painful and some stages not. Other injuries to soft tissue, amputation injuries, I mean the list just goes on and on. Pain accompanying surgery, but basically anything that affects the soma or the receptors in the external portion of the body itself can produce pain. And another real common example of somatic pain would be things like arthritis. Arthritis, something is, arthritis is a term that in the clinic is sometimes called the Wastebasket Diagnosis, meaning it's the slot that a healthcare professional will throw at a patient with skeletal pain when we're not sure exactly what's going on. That was much more common 30 years ago when we didn't have the advanced diagnostics that we have now. But arthritis in and of itself can cause many types of pain issues. Joint pain, of course, from a number of different causes. Knee injuries are very common, ankle injuries are very common. All those can produce somatic pain, which just about everybody on the face of the planet has experienced or will experience at some particular point in time. Tension headache is another very, very common form of chronic pain. And we'll talk about that some more too, because headaches are very debilitating, and there's fortunately a lot that can be done for most types of headaches. Another type of chronic pain that falls in the somatic category that we talked about earlier is when you have a laceration. For example, if you've ever sustained a cut to your skin and you've had to either have it closed with glue or sutures, you know how painful that can be, and you know how exquisitely tender it can be. You know that if it occurs on a part of the body that is extremely sensitive, such as a fingertip or a toe, the parts of the body that make up the soma and are loaded with very, very vast amounts of nerve endings, how difficult that particular type of pain can be. So when those types of things go on for extended periods of time, that does result in chronic somatic pain. The good news is with somatic pain is that even though it might go on for a long period of time, oftentimes it's one of the easiest forms of chronic pain to treat. The types of pain that we're going to talk about when we come back from the break are unfortunately much more challenging to treat. Not impossible, but definitely require a lot more thought and a lot more explanation. So again, you're listening to Beating Neuropathy and Chronic Pain on 95.9 WATD, and we'll be back in just a moment.